Hello, good afternoon. This is Dr. Velma Scantlebury coming to you live from the Delaware Health Equity Coalition. And it is 4 p.m. on Wednesday, June 17th. And we are here bringing information to you from Dialysis Patient Citizens Education Center, and I am the medical director. I am Dr. Velma Scantlebury, and I am here with our usual Facebook session on the third Wednesday of the month, and this is June, and I would like to welcome all of you who would like to come on and talk about anything you would like to talk about. This is an open slate, so join us, myself, along with my partner in crime, who is always in the background, Miss Nancy, who generally will feed me some questions. So waiting for Miss Nancy Scott to come on, and hopefully we'll be able to be joined by some other members of our group so that we can have this conversation. So I definitely appreciate it, and I look forward to answering your questions. So it is a bright day here in Delaware, and we are having a lovely Wednesday. The sun is out, as you probably can't tell from this angle of the room, but certainly we hope that you will be available this afternoon. You're probably out and about doing lots of fun things. But I'm here to talk about anything you would like to talk about. I am in Wilmington, Delaware, and I'm not sure if you've been watching the news, but we did have a shooting here, probably about 2 miles from where I am at the Christiana Care Hospital, Wilmington campus, where a temporary employee or an employee somehow made it into the building with a gun, ended up shooting 2 other co-workers, one fatally, that have been reported, which is very, very unfortunate. We don't like to have workplace violence, and it's a shame that it got to this point. I know the hospital does have entrance ways where metal detectors in order to go into the hospital, but there are generally no metal detectors for those who are employees, and there are employee entrance where you're supposed to scan your badge to get in. And so very, very unfortunate incidents, and my heart goes out to the family of those who were, of that young person who was fatally injured, and the other young man who was also injured but has lived, and also to the family of the shooter, because it's very unfortunate. We don't know what was going through his head, what led him to this place of anger, or just the ability to want to go get a gun and shoot others. So we just have to spread love. We just have to really reach out to those who may be facing difficult situations. So if you know our anger or seeking, need help. Mental health is a big stigma, and oftentimes it's nobody wants to feel or to know that they're having difficulties or having to face difficulties. And so it's so very unfortunate, but we're glad that not many others, there were no other injuries, and there are no other deaths, and that he has been apprehended, and hopefully this will be all behind us. But I'm sure those who work there or were intimately involved, even witnessed the shooting, will probably need to have some counseling. And unfortunately, I think each and every one of us in our own lifetime would have to deal with unfortunate incidences. We will have our dark days, but we're here to support each other, and we're here to make sure that if we are educators or if we are leaders, that we listen. We people and those around us just want to be heard. They don't want to be dismissed. And so it's important to have that compassion. It's important to listen and be proximal to those who we attend to, who we work with. And so I'm here. I welcome Laura, and I see Nancy is on. It's a beautiful day outside, so maybe folks are busy doing what they do best and enjoying the weather. I don't blame them. But certainly, if you have any questions or any topics you would like to discuss, I'm here for you. As we get into the summer, for those of you who are in dialysis, it's always an issue. Now it's getting hot, and how do you keep from drinking so much when you know you're thirsty and you are unable to take in the amount of liquids? Then you're feeling like, I am dry, what can I eat? And it's often good to think about, what kind of things can I do? How can I be innovative in terms of being able to quench my thirst, get that chill on, but not consume a lot of water? So thank you for watching. For Laura and Arthur and Yolanda coming on, and Nancy, I'm Dr. Velma Scantlebury. I'm the medical director here at DPC Education Center. And this is our Facebook Ask the Doctor session. And I'm just going to get started with keeping cool and how you can be creative with your intake. Certainly try to freeze things. Take your grapes, freeze them, cut up your fruits, and you can blend them in the blender and mush them, and then put them in your freezer trays and make little cubes that you can eat one at a time, so that you're keeping track of what fluid you're taking in. And it's always a great way to freeze as much as you can, because that's something you can eat slowly and not consume a whole lot, because especially if it has a high water content and you are on dialysis and your fluid restriction. Certainly if you're not on fluid restriction, it's not an issue, but you do want to be careful with your intake, and you want to be careful with your phosphorus intake when you begin eating these things. Anxiety and stress are also common in renal patients. What do you suggest if a patient asks for your help? Certainly, it's definitely acknowledged that that you are grateful that they're reaching out for help. It's often takes a lot for someone to say, I need help. And so that is also very important. But if you're not the right person to deal with their mental situation and anxiety and stress, make sure that you refer them to the appropriate person. It may be their primary physician, it may be their nephrologist, but you want to be able to help that person through it. Sometimes it may not necessarily need medication, but it may be that they just need to have a therapist or someone that they can talk through their anxiety, what's causing their stress, and acknowledge that these things are real, and that what may seem mundane to one person may be just what's triggering the other person. And so we want to know that especially these days, there's a whole lot that can cause anxiety and stress in all of us. And even, it's not unusual, and there's no stigma on you to seek help or even begin to say, I need a therapist. And the nice thing about our office here is that we have therapists in the office that we can refer patients to. They can come into the room, meet with the patient. They can come in the office instead of seeing the doctor to see the mental health provider in a way that allows them to not be stigmatized or feel like there's a name on the outside that says therapist. No, we don't do that. But it is important for patients to understand that there's help available. There's so much that can be causing stress. Just the whole idea of dealing with your illness, dealing with family, if you're a caretaker, dealing with your loved ones, issues, and trying to feel how do you be the support for people or that person you love when you feel you're not doing an adequate job, or you could do better, or they're not somehow you're not doing the best that you feel you can. And so I think it's important to, if not your physician, your nurse practitioner, even the nurse in the dialysis unit, and the social worker, they're always there to provide that help for patients in need, and even for patients even post-transplant. Certainly we know that immunosuppression or steroids or even just going through rejection can be hard on patients. And so even dealing with the loss of a kidney that you thought was going to go well, and suddenly no, that kidney didn't last. And so it is important to get that kind of help. Many patients have to eventually get medical care from a cardiologist after transplant. Please explain. Certainly when you look at the two primary causes of kidney disease, it's high blood pressure and diabetes, and both of these by itself and together can cause kidney disease. And I tell patients, if you didn't have heart disease before you develop kidney disease, then you may end up with heart disease, because once you hit dialysis and you have those issues with fluid volume, the longer you are on dialysis, the more stress you place on your heart, and patients end up with cardiomyopathy. If you have issues with phosphorus deposition, high cholesterol, high phosphorus lipids, you may be more subjected to coronary artery disease, valvular disease. So patients would end up with underlying cardiomyopathy, stress on the aortic valve or mitral valve issues, which may be leaky valves or stenosis valves, or even pulmonary hypertension, which can affect the right side of the heart. If you have long-term, certainly many patients will undergo a cardiac evaluation prior to transplantation, which may be an echocardiogram or a stress test, a exercise or diminished stress test. But if there's any issues that are there, you need to continue seeing that cardiologist afterwards. It's important to make sure that your blood pressure is well controlled even after transplantation, to prevent further heart disease, and that your diabetes is controlled to prevent further disease. If you have stents placed or bypass surgery prior to transplant, after transplant, those are things that need to be followed through too. Many patients I send to cardiologists because even though they had a transplant, they still have significant cardiomyopathy. Their heart ejection fraction may be a little lower than normal, and you want to make sure that the cardiologist is there to maximize the drugs to make your heart pump as best as possible. So those things are important to follow through. Bypass surgery, follow up with your cardiologist. Stents, follow up with your cardiologist. So yeah, it's very necessary, as depending on your process prior to transplant, to make sure that you continue to stay healthy. Our June e-letter, e-news focused on living donors. What are the most frequent changes in this process? When you think about living donation, you have, for those of you if you've ever had a living donor, then you know if you're seeking or have someone who's being considered a living donor, you know that it's important for that person to be in good health. And for us, it's making sure that we evaluate, the transplant center, evaluate that potential donor to make sure that they are not at risk for kidney disease down the line. And so we will then put them through the rigors to make sure that once they donate a kidney, that the underlying kidney is not at risk for developing kidney disease. If you don't have a crystal ball, but it's the predictions in terms of looking at blood work and looking at the function with 2 kidneys, minus 1 kidney, minus the age of the donor, will that person be able to survive with that 1 kidney for the rest of their life without needing a kidney transplant? So those things are important. What are the most frequent changes in the process? Generally, you want to make sure that in the process, certainly in the process of living donation, that person, one, is healthy. There are no predictable ones. You want to make sure that they have 2 kidneys and that both kidneys, each kidney can stand alone minus the 1 kidney, And even after removing that kidney, that the donor understands that there should not be any quick changes in weight. You don't want to gain a lot of weight. Remember that one kidney that's left behind will take time to compensate from the loss of the paired kidney, and now it has to work alone. So your kidney function after donation may go down to 50% because now you've taken away one kidney. It may go down to 45%, but the goal is to be able to have that kidney slowly recoup the work of the other kidney and slowly increase, so that over the 6 months after donation, you'll see an increase in the living donor's kidney function increase to 60, 70, 80%, and there are some donors who get up to 90%, and that single kidney will enlarge and compensate for the lack of the other kidney. What you don't want to do is to gain a lot of weight in that period that the kidney is compensating for the loss of, because now it's working harder. And so we caution donors about that weight gain. You also don't want to stress the kidney by using a lot of protein muscle building, protein building recipes, because you don't want that protein load can be hard on the kidney during those times. So for many donors, in terms of living donors, the other changes that occur is that during the process of the workup, that living donor has a lot of focus on them, making sure they're seeing everyone, that they're healthy, that they're visiting all the different required therapists, doctors, to make sure they're in good health. And then after the transplant, now they've given their kidney, and the focus goes from them to the recipient. And they're healthy, say how we know you're doing well, your other kidney's doing well, we'll see you in 3 months. We'll see you in a month, 3 months, 6 months, and the focus is taken off of them. And sometimes for donors, that's a little bit hard to deal with. And so they can go through that episode of feeling rejected or depression. So I said, if you're a living donor to someone, and you had to receive a kidney from a living donor, make sure and that you know that person, make sure that you try to keep in touch with them, a family member, so that they understand what's going on with the recipient. Grapefruit juice and grapefruits are the first things transplant patients are told not to eat. Are there other foods to avoid? I think for some folks it's like monk fruit and other fruits that I don't remember offhand, but many of these fruits interfere with how your body processes the immunosuppression, and especially the Prograf, the tacrolimus, and the cyclosporine. So the metabolism of those medications interact because of the presence of some of these citrus fruits. And so that's one reason why we're told to avoid them, because it can make your levels go up and down. Because if we don't always, if you eat something, you want to eat it every single day so that we can know how to adjust the medications. But those aren't things that we eat every single day without our medication. And so your levels can go up or down, cause rejection when we feel it should be higher than that. And so it causes too much manipulation and puts your kidney at risk of rejection. So you want to make sure that you just avoid them so that we are not trying to constantly work to adjust your levels, which means we constantly have to do blood work every single month and change your doses. So you don't want to do that. Many dialysis patients are afraid to travel because they don't want to dialyze at another center. How can they be encouraged with no pressure? I certainly think that working with your own dialysis unit and working with your care team can help avoid some of this stress and pressure by planning ahead, knowing where you're going, being able to do some research so that they can find a dialysis center that can accommodate you if you are on hemodialysis and can fit you in for the times that you're there. And so it's important to let them know ahead of time. If you know you are you familiar with where you're going, or there's family members there, then those are things that you advanced planning is always best, because you don't want to be suddenly stranded and not have a dialysis center to dialyze you. If you're just going away for 3 days, and you can work it out with your dialysis center, but it's easy to travel with advanced planning and being able to set up that dialysis center. Remember, they don't know you, and oftentimes if it's a very small unit, they may not necessarily want to, they may have set patients with no free spots. So that's, you may have to travel, and understand you may have to travel if there's no dialysis center that has a free chair available for your time slot. So be understanding and work with your dialysis, but don't sit at home just because you don't want to do a little homework to get there. So enlist your family members who and friends who may be willing to help you through the process of getting there, so you can get to leave and have a few days away from your own environment. We certainly want to, for those of you who are here, go ahead and ask some questions. As Nancy says, she's doing all the asking of all the questions. Thank you, LaRonda, for joining, and Arthur. Certainly, if there's questions you want to ask, thank you, Yolanda, for being here. We know it's summertime. We want to make sure that you be out there. Make sure you put on your sunscreen and your sunblock when you're outside. We want you to get your vitamin D, but we also don't want you to burn or be at risk for any kind of skin issues that you may have. A patient is sick and tired of dialysis. What do you suggest? Find a donor. See if there's someone who can donate to you. Begin to seek avenues. Get on the list. If you're a possible candidate and you're on the list and you're still not getting called because you have the blood type A or O, or you may have high antibody level, then you want to do your best to seek groups that may be more motivated to provide a living donor. You want to reach out to friends and family, different various clubs, book club, bingo club. If you don't belong to a place of worship, join a place of worship. Share your story. Get on a platform on social media so you can share your story and be able to let other people know of your plight. You never know who may be sparked to donate or tell their loved one about someone who needs a kidney. So let other people know what's going on with you, and know that there are thousands of people in your dilemma. But the goal is definitely continue to stay positive. There's always, if you are not on a transplant list or have the ability to get on more than one transplant list, do so. Seek out family members live in other places to see if you can stay with someone if you happen to get on that transplant list. I've traveled a lot on the East Coast at Fresenius and DeVita and never had a bad experience. Thank you, Arthur, for that. Other people need to know that it is certainly possible to get around, and just connect with your dialysis social worker, or someone who can make a few phone calls and get you set up so that you can continue your dialysis. Like you said, there used to be cruises with that. You can dialyze if you have kidney failure. There are some cruise lines would allow you to dialyze on the cruise. So those are things you can look into. What can cause your protein levels to be low, and how can you increase this from a transplant patient? One of the things with your protein, you want to make sure that part of your underlying nephropathy isn't that you're not losing protein in your urine. You don't have a protein nephropathy, but in terms of getting your protein up after transplant, it's one, being able to, if your kidney function is good, is you have to focus a little bit more on protein containing foods. And sometimes it's hard because you're not used to eating the kind of things that you may not you couldn't eat on dialysis, but now you now have to push that protein, and that can be difficult. But you have to sacrifice protein, carbs for protein, and even with our normal now nutritionist push for patients who want to lose weight is trying to say, okay, if you don't have an issue with your kidneys, then you should be able to handle. Your goal should be almost 1 per kilo or 0.8 grams of protein per kilo. So if you're 80 kilos, you want to see if you can get in 70 grams of protein a day so that you can get that protein up. So you have to be conscious about what you're eating and think about where's my protein source. It's good to have a salad, but in that salad, because you want to be nutritious, where's my protein? Am I getting that protein in my 2 meals or my 3 meals, or can I add that protein in as a snack in terms of counting protein? So you have to be conscious about counting your protein, the number of grams per meal, knowing that things like an egg, even if you have high cholesterol, you may just use egg whites, but a natural egg may have 78 grams or 79 grams of protein per egg white. So if you have 2 of those in the morning, then you have about 15, 16 grams of protein. So there's your start with very little. And so you keep adding. If you're a dairy problem person, you want a Greek yogurt is a good source. If you like or dislike cottage cheese, that's also a good source if you're a transplant patient. If you can't eat dairy, then you want to look for other sources of protein. You might have to do protein supplement, collagen protein, those kind of things to be able to get your protein in. If you're a fish eater, chicken breast, meat, chicken, fish. If you're pescatarian, it's fine. If you're vegetarian, then you want to look at different ways, so whether it's chickpeas, beans, tofu. With every meal, you're counting to see whether you can get your protein. And if you focus on your 0.8 grams of protein per kilo of your weight, it may be difficult, but the goal is to be able to sacrifice carbs to get your protein in, so you can decrease your edema, because the lower your protein is in your body, the more swelling of fluid will accumulate in your tissue. So it becomes important to push your protein up. Plus it gives you more energy and makes you feel better when you're consuming protein, but it also takes away your desire to snack. So you're going to feel fuller with your protein intake or your protein shake. You can certainly look for protein supplements, whether it's Ensure or Boost or Glucerna, to help with your protein intake from that standpoint. So I appreciate all of you. If there are any other questions, we've got about 2 minutes to go. I think we covered all the questions. Again, for those of you who've who want to travel, be sure don't let it inhibit you from getting around just because you're on dialysis. Even if you're on PD, you can have all that stuff sent or shipped to your location ahead of time so that you're not traveling with it. So you arrive there and you have all your stuff. Certainly it's much easier now than it was 10 or 20 years ago. So do what you can, but remember to stay healthy as we go into the summer. Be conscious of your fluid intake. Be conscious of your phosphorus. I know we'll all be tempted to have a little bit of ice cream because it's hot outside, but still be conscious of your phosphorus containing foods, because you do not want your phosphorus to get out of hand. Just remember, the bottom line of all this is that you got to keep your heart healthy. Your heart is the critical factor in all of these equations, and so heart health is going to be what's going to be your ultimate lifeline. So stay healthy, enjoy life, and be blessed, and I'll see you in a month. Take care.